The functional relationship between hip joint, pelvis, lumbar region, Part 1. Hip flexion contributes to the change in pelvic rotation angle. When we rotate the hip, the chain reaction includes posterior pelvic tilt. In addition, the sacrum rotates and the lumbar lotus is flattened. 1. Hip flexion. 2. PPT posterior pelvic tilt. 3. Sacral rotation. Counter notation. 4. Flattening of the lordosis. When lifting the leg, the connection of the muscle ligament and fascia tissues causes a chain reaction. The posterior tilt motion of pelvis increased when the knees above the pelvis. In this posterior view, we see the muscles and ligaments that connect the hip to the pelvis. Hip flexion directly affects the pelvis. The ligaments and muscles simply pull the pelvis and the sacrum and rotate them. A focused look at the posterior ligament that connects the femur head to the pelvis. You can see the direct chain reaction between knee flexion and hip rotation. Why should we know this? As a result of the knees above the pelvis, additional chain reactions take place, which also begin to affect the position of the pelvis and vertebral column. In this position, the trainee is unable to maintain a neutral position, slight anterior pelvic tilt. In this position, do not expect from the trainee to maintain NP, neutral position. Sitting with knees higher than the pelvis causes compressive pressure on the vertebrae and symptoms of pain in the lower back following prolonged exercising. We can see it in strength exercises, low chair with high knees, or lifting the weight off the floor, low chair, high knees.